Good afternoon. This is Will Jordan. I'm the Chief of Vascular Surgery at Emory University in Atlanta, Georgia. You're listening to Interview with the Surgeon Agent.
On this episode of Interview with the Surgeon, we welcome Dr. William Jordan, Chief of Vascular Surgery and Endovascular Therapy at Emory University School of Medicine, and Director, Vascular Surgery Service, Emory Healthcare. Clinical and research interests encompass the minimally invasive treatment of aortic diseases, carotid artery diseases, and peripheral vascular diseases. Involvement in clinical research includes a well-funded research portfolio.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. William Jordan, Chief of Vascular Surgery at Emory. Doc, how are we doing today?
Doing great, Matt. Thanks for having me.
Thanks for being with us. So let's just jump right into it. What were your goals and aspirations during your residency, and how did those change during your fellowship?
I would suggest that anytime you walk into a new job, there's a certain level of anxiety and concern about where am I going, what can I do, can I be successful? And so my goals were basically to get through those training milestones to make certain that first I could manage patients. Once I got through that phase, then I wanted to know that I could do the technical parts of the operation. And these were basic operations at first, taking out an appendix, fixing a hernia. Those were sort of the things that you first were focused on. They change as you gain experience and you start to know patients that can change as one goes through their training program. You start to develop an affinity to a patient type, like your personalities match. I think that's an important part of sort of where you go moving forward. I also, and then when I had that affinity to vascular surgery, I started to really feel that probably even as early as second year. Got more drawn to it during my third year of the 5-year training program I was in. And then once selecting the fellowship program, you're saying, wow, can I do this complex surgery? And there are a lot of technical parts of doing vascular surgery that are sort of a high stress environment because you're dealing with blood flowing, and if you make an error, that it can be a sudden change in the events of the patient in the operating room. So there are technical parts of that that are hard. And once you get through the technical parts, and hey, this is nice, this works, then you get to the more advanced technical parts, a higher stress situation, redo surgery, infected grafts, things like that. And once I could see that I enjoyed that part, I enjoyed each one of those challenges. That sort of pushed me to the next step. Okay, what else can I do? Is there another goal that I can accomplish? So it did change some with time, but I think, as you suggested earlier, it's a mindset. It was sort of, what else can I accomplish? And it's partly because I'm task-oriented, and so I wanted to do that. That's a great question. Thank you.
So during your fellowship, can you kind of take us through your mentality heading into your first job search and how that perspective changed in the beginning years of your career?
Yeah, so disclosure, I thought as I was finishing my fellowship that I was going to walk into a fantastic private practice opportunity with my father, who's a vascular surgeon. And certainly he was some of my inspiration to go down this path. It was a nice practice in a well-established hospital in Atlanta, where I am now. And it's interesting, my teachers, my trainers in my fellowship program, they all expected me to go there too. Instead, the place where I did my general surgery, University of Alabama, Birmingham, they had an opening. They started sort of recruiting and making comments to me relatively early on, before I even left, before I finished my residency. And so that's when my mindset changed a little bit. Can I do an academic practice? Somehow I answered the earlier question. Can I go hop to the more complex vascular surgery? Being in a community practice, most of that is what we would call primary vascular surgery, where you're referred from a primary care doctor. When you get to academic vascular and you become a referral center, that's where many of those referrals comes from other surgeons. So these are cases that are reoperative cases. These are cases that might have an infection associated with some other vascular surgery. So by nature, they become more complex. And I think that at this point, this is where I was really looking, can I go to that level and practice on that level? It was another challenge. It was another interest. And I had an affinity to my general surgery program. So I was really sort of headed down a community practice, private practice, great opportunity. a little bit tough to tell your father no thank you. And I still have a great relationship with him. Got to visit with him yesterday. Um, but it was this was an area that I thought someplace I wanted to go. I wanted to try. And, that's another sort of goal-oriented approach, and that was my attraction. That's how I got started.
Can you kind of take us through your journey on how you ended up being the chief of vascular surgery?
Um, there are a couple of versions, and one would be something as simple as going back to UAB. And I was, they'd been a group of 3 surgeons for a while, but they were down to 1 who was relatively senior. And so I walked in as the 2nd surgeon in that group. And just to give you some sense, he was senior enough that he looked at me and he said, "Will, I think it's great you're here. We're going to split call 50-50. I said, "That's great, Dr. McDowell." He said, "Yes, I took it the first 20 years. You're going to take it the next 20 years. And so I tell you that because how did I get to be chief? I say I was really the last man standing. He was senior. I was junior. He was winding down. He said, "Here, you take it." And frankly, there was another challenge. There's another situation. And, the next phase, once you get to chief, you got to start recruiting other people. My first recruit came in 97. So after I'd been there 3 years, I started in 94. And so then you're recruiting people and you're building. And then this was about the time a second recruit came in 99. So we were 3 surgeons in 99. And then the endovascular era started to take off. We were well positioned that we could take the referrals. We went in there with a very much a can-do attitude. When someone called and said, "Can I send this patient?" We had the attitude of, "Thank you, may I have another? Thank you, yes, of course, we'd be happy to see your patient." And that helped build our clinical volume. And from there, having that clinical volume and having that interest in some clinical research, that sort of leveraged to that other advantage of then starting getting into doing clinical trials, testing new equipment, new devices, new tools, and seeing what would work. Now, I tell you that in terms of a volume, and that's one area where I think that I was afforded some success in my career. But some of it just plain happenstance and being in the right place at the right time. In one of those particular areas, I walked into an environment where carotid stenting was starting. And this was 1994, so relatively early in the era. Carotid stenting probably first was introduced just a few years before that. But there was a particularly aggressive group of cardiologists who were very much promoting this new therapy. And I created some concern just on how they were promoting it. And I was the brand new surgeon, new attending. Had a little bit of history because I'd done some training there, left and came back. And as I was moving through that, we started that evaluation together, and I was a little more critical than I think they wanted. That created a little bit of tension in the relationship because they were very much gung-ho in this new therapy, and I was more cautious about it. That tension became evident external to the environment, external to our university. The vascular and cardiology community picked up on that tension, and that created a situation where people would invite you to different meetings to have almost a debate format. That was another opportunity that I was sort of, I guess for lack of a better term, I was thrust into the carotid stenting limelight relatively early. And some of that, they call it getting a break, sort of being in the right place and then figuring out how to work on principles and still moving forward and all that.
So what would you say were some of the keys to your success that shaped your early career as you climbed to the top of the industry?
Well, Matt, that's a nice question. You're assuming I'm at the top of my industry, but I appreciate the compliment. The keys I think are a very much a can-do attitude and what they call the 4 A's. But the point is just saying, yes, I'll do it. Let me help figure it out. And it's something simple as having a can-do approach and also be welcoming and say that, okay, let me figure this out. And frankly, I think that's sort of the can-do approach and being receptive to people who needed the service or wanted the service was one part. Another part, I guess they would say in today's world, being nice and friendly. and I think that part of that is sort of exuding and having a friendly posture when you're out there. It can be difficult for those who sometimes have creases in their face and look more intense on a facial expression. I know there are other words for it, but I think the key is just saying, yeah, I want to go work with people. I want to be a part of this. I want to be a part of the solution, not the problem. I want to figure this out and make it work. And I think that helps anywhere you go.
What advice do you have for the graduating residents and fellows as they enter the professional job market for the first time?
I, First, I would comment that the world is very different than when I was searching back in, yes, I started in 93 and then 94 is when I completed that. Today, I spend a fair amount of my time recruiting new graduates and say, hey, and then helping graduates get started in their program. I want to hear someone being direct. I want some, I was going to use the term honesty, and that probably that can come across differently. Being at least honest in terms of what you really think you can do, what you want to do, what's appropriate. So many come out with certain criteria. They say, oh, I want to be involved in teaching and education and training. Well, one reason, I think when they say that they don't always understand what it means to do that, because it's clear that was one of my affinities. I like the training environment, but it's partly because that's all we know, because we came along in the training environment. These are the people around us, and we said, oh yes, I like that attending. I want to be like that attending and help train the next generation. That's great, and we understand that. But stop for a minute and think, is that really the environment you want? And frankly, I want someone to tell me, I prefer this environment, or I prefer more of a private practice, or what we probably call more commonly a community setting, because so much of us are in health systems now, where they go out and they work and they take care of patients on a regular basis. I think that's important, to be honest what you want. And the next thing is, I would tell you to be open for different possibilities. I think people, particularly the current graduates, are very much attracted to large metro cities. They don't always think about different type environments where they can be successful. And maybe I'm saying that now because I'm living in a large metro city, and so I feel people coming at me with that request. And I think it's great, but I think sometimes you might be missing opportunities where you can be in not such a large metro area and have a very good practice, a very good life outside of practice. And I think that ultimately leads to both professional and personal happiness, because you got to be satisfied at what you're doing, and be a little careful going into the interview just saying what you think they want to hear. That commonly will come out at some point. And frankly, I think it's so important to be, I've told plenty of folks this, to be aligned with your leadership. Think the same way, have an understanding. It's okay to disagree with someone on whether it's a professional opinion about how you treat a patient, or even a different approach on something, but you need to know what that is. And I guess I'm really asking for a professional, full dialogue is probably a good way to say it. Hey, here are my likes, here are my interests, this is what would fit. That's probably a good thing. I'm going to go ahead and talk a little bit more about that. What's the right approach? A common thing, and sort of at the peak of the professional satisfaction, is what we do when we go out and treat patients. The great case everybody wants is aortic surgery. Everyone wants to come out and be an aortic surgeon. That takes time. It's hard to walk into a practice and be an aortic surgeon. You either have to, generally in today's environment, you have to sort of get in line and work and learn from people who have done this before, show that same level of commitment, show that same level of study and understanding, and then you work into it. That's one path. Another path is essentially go to what I'm going to call a vascular desert, someplace where nobody's been. And then you've got to you have to pave that way yourself. I think those are two avenues to go. There are not too many vascular deserts in today's world. There are areas where there are not as many, but you certainly can go to an underserved area, a smaller community, and get into some of that higher level care, recognizing that it's going to take a little bit more work, but that's still something you can do.
So what advice do you have for the graduating class this year that would normally be able to meet folks like yourself at national conferences? Now everything's being done virtually, and this graduating class is really trying to figure out what that network outreach looks like.
That's a great point. We're struggling with this whole networking and electronic the virtual meetings and video conferencing. I think that you still can explore this, and there's still options. The disadvantage for this cycle, at least, and it may change in the next few months, but there are not a lot of people hiring because of the economic uncertainty. So I think you have to be patient. I think ideally that a lot of people like to wrap up their job choice within the first couple of months of their last year, so September, October, which we're walking into. I would be really surprised if somebody's going to give you a guarantee this early. We don't know about a solution to our current financial impact associated with the pandemic. So I would tell you to probably be patient, still continue to pursue leads that you have. I got to tell you, I think in the vascular world, the community is relatively small. The networking where your program director contacts someone they know, or just makes that contact, I think that goes a long way. When I get a direct recommendation from someone, that goes farther than someone coming as a pure cold call, or coming through a headhunter. Frankly, when someone's coming through a headhunter, you're not really certain. When they come, I should probably say a professional recruiter. That's probably more appropriate than headhunter. But I would tell you that it helps to have that connection. And sometimes you might have to work at that, whether it's your program director or maybe the program director has no idea if you want to go to some city that they have no connection to. But usually if you start looking at second and third order, look on LinkedIn, look on one of those networking pathways. I think that can help. I think that those are very much important components about what you're going to do and how you're going to approach this job search.
Can you talk about your involvement with SCVS and SBS?
So working through the societal structure, I think is very important, both for academic success, but also for professional success. You do not have to be in academics to be successful in the societies. I tell residents and fellows now that the people that you meet on this interview trail when you're going through and when you go and see at these meetings, that these will be your professional friends for life. You will continually see these people at meetings. And that's where you make those contacts. And these are the people you'll start to build your families together. And sometimes we bring our families to these meetings and they have great times. They build great memories. I think that you should foster that. We work a lot. That's how somehow we're built, we're made. We want to go do a lot of work, get a lot done. So you don't spend as much time socializing. So I think that that's important to go to the meetings for the socializing part. If you want to contribute in terms of contribute more than membership and attendance, with both are important. If you want to do presentations, if you want to be on committee service, put your hand up. And when you put your hand up, commit to it and say, hey, I'll go do that work. And it does take extra work. It takes time away from family if you're going to work nights and weekends. Sometimes you have to do extra travel. And I think when you do the work and you show a commitment, and then you also contribute to the science of the society, meaning you submit an abstract to get on the program, to be a poster, to do a presentation, that gets noticed. And that's how you say, oh, then you do a committee structure and you work through a committee, you become chair of a committee, then you get appointed on the council. And it takes time. Now, that's what we call a meritocracy, I guess, as you sort of build in what you do and you can build to that level. But I got to tell you that we are also very attentive towards having diversity throughout our societies. And I want to encourage groups that don't look like they're represented because of certain phenotypes we're used to seeing, to recognize that no, there's a lot of attention and we want diversity, diversity in all areas, including diversity of opinion and diversity of thought and having some open dialogue, but different looking people. We want to get underrepresented groups promoted through societies. So I would tell you, if you want to participate, put your hand up, let them know, hey, I'd like to do something, be visible, attend the meeting, and contribute where you can. Currently, I'm president of the Society for the Clinical Vascular Surgery, and that would be that's a national organization, probably the second largest behind the granddaddy, which is Society for Vascular Surgery. The clinical is also known as the Society for Cut and Vascular Surgeons because they are clinically oriented, not quite as academically oriented. I like to say I sort of play a role in both. That is, it is a fun organization because you get professional satisfaction. I do. I see how people grow. I see how people develop. You do have to deal with some controversy at times, just because adult alpha performing surgeons will misbehave, and you have to go sort of figure out how to manage some of that. And so you don't always want to be in the news. We've managed to dodge a couple. But the role is really looking around amongst your peers, and you get put in that role because your peers respect you, and you respect them back, and that just goes a long way when someone who's at your level says, "Hey, we want you to lead our society." I was supposed to do 1 year. The pandemic messed that up. Some people tell me I needed to be remediated and do a second year, so I'm stuck in it for 2 years. But again, that was as you build through the council, and so you learn things. And so you learn also how organizations work. You learn how societies develop. You learn a little bit of business side of this too. And you understand somehow the business can impact what we do. The clinical is very big on resident and fellow education. We have a very sophisticated program where we have different groups and they do these side programs. That's so satisfying to watch these people come through. You can do a little recruiting if you're looking for someone, so it's also nice. In our groups, we get together, so that's been a lot of fun. So that's the clinical. The Society for Vascular Surgery, that's our largest organization, 5,000 plus members. I've had intermittent appointments on councils and been on the board there. As a strategic board, not the executive board, as they say. It's had some morphing through the years, and that's fun. It does take more work. That's the one that is really sort of considered the leadership of our specialty. You've got to deal with some politics. The good part is we generally each other. I mean, they're 5,000 strong, and I know it's a big group, but when you've been doing it for 20 years, you pretty much know each other. And it's fun to watch people go through, and it's great to have professional dialogue. And frankly, we have professional disagreements, and that's sort of fun. I think my other joke is that you put 4 vascular surgeons in a room and you ask them their opinion, you'll get 5 opinions. By the time it goes around, somebody's changed their mind. They want to do something different. We're a dynamic group. We're a growing group. We have a lot of fun at taking care of patients and then trying to advance the specialty.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.